program because I wanted to have wide spectrum family practice. I have a commitment through the government to go work in an underserved area of the country after I finish residency. So I wanted to be able to get out there and really know that I knew my stuff beforehand, and to know a lot of different procedures, to know how to do a C-section, to know how to do an appendectomy in case those types of circumstances showed up in my life. So this program was one of the few in the country that offered as wide spectrum family practice as this does.
So the registrar system is a system that's absolutely fabulous. It's derived from the British healthcare system, and basically it means that you work one-on-one with attending who is working only with you on your patients. So instead of a traditional team approach that you see often in the university systems, the system here is that you work one-on-one with an attending. You don't work with other residents, and so you are the primary caregiver for your patients, which is totally just the reverse of what you see in a university setting. And it gives you a lot more independence, a lot more autonomy, and I think ultimately a lot more confidence in being able to take care of patients.
There's several kinds of medical students who do particularly well here. I think one of the major groups are groups who have a particular interest in working in remote care, rural care, and in international health. I would say particularly international health because the broad spectrum of training allows them to really function at a high level in areas with extreme need and poverty. The other groups that do very well are people who really have kind of an experiential learning style. They learn through doing things. They're into hands-on training. They want to get full spectrum training, procedural training, get in the thick of patient care and responsibility. Those students succeed very well here, and I think really get a lot out of the program. The third group are folks who really are interested in doing some academic kind of teaching. They really are looking at learning to become teachers or leaders in family medicine. And I think because of our unique registrar structure and teaching structure here, they really get to see teaching from family physicians in a very prominent role in the hospital and clinics.
I really wanted to do full spectrum family practice, and I came here as a medical student, and my very first day they let me do a whole surgical procedure by myself with this attending standing behind me. That's why I chose this program.
And you're never alone here. I mean, it's, we say, it's somebody who likes to do a lot of stuff and have a lot of responsibility, but you're never alone. There's always someone to ask. There's always someone by your side, every day. So, but, you get to do a lot.
Here your only limits are what you place on yourself, not expectations of other people. I feel like because I came here, I am independent, I feel confident about what I can do for other people, and I feel like I wouldn't have learned that somewhere else.
Things that kept me on a staff are pretty much the same factors that brought me here during residency training program. The general atmosphere of the system that we work, in which we work. People are very dedicated, very collegial, and really sincere with the work that they do. And so it's that feeling and that spirit that really kept me here. When I came as a resident and trained, I grew into that and really became part of that movement, and so it's really one of the forces that kept me here.
One thing that does seem different and good here is that the residents, I think, are really taken very seriously by the administration of the residency program, and their ideas are when the residents come with a problem, a question, something they want to change, they're never brushed off. There's, a committee is formed, there's a lot of discussion back and forth, there may be competing interests or different needs, but they're never ignored. And I think in a lot of programs there may be kind of lip service to the resident interest, but I think here the program changes and turns based on resident interest. And I think people can come here knowing full well that if they're interested in change or developing new programs or have opinions, that those will be listened to and paid a lot of attention to.
One of the things that's really great about this program is the involvement that the residents have in making changes to the curriculum. So this unique opportunity was brought to the residents, and we were supposed to come up with a proposal based on what we thought were the shortcomings in our curriculum, and what we thought would address those shortcomings. We came up with a proposal that we were anticipating there'd be a lot of back and forth with the administration. They'd like some of our ideas, they wouldn't like other ideas. But they basically said, you know, you guys thought up this proposal really carefully, obviously. You talked about it a lot, you talked to a lot of people about it. You clearly think that this is going to address the needs you have in your education, and you guys are the best people to know what those needs are, so let's just do it.
We have amazing residents. They're dedicated, they're bright, they want to work, they want to take care of, I think, a special patient population that we have, who have, you know, not only a lot of medical problems, but a lot of social issues.
Well, I think a lot of the people here, and the reason this program was made by Dr. Degnan many years ago was because he wanted to get people to help the poor and the underserved, and that kind of, you know, good morale and good ethics have continued on.
As a matter of fact, my own family says, why are you working in county? You know, why can't you be a real doctor? They do have the assumption that county, you know, only bad doctors work for county, and only bad patients come to county, which is not the case. I mean, I think we have great faculty, we have great patients, and it's a lot of learning. The reason people are here, the main reason, is because they like to work with low-income people.
If I were to get sick or need surgery, I would come here in a second. We have a neurosurgeon who does not belong to this health plan because he's a contract physician. He had a family member who needed surgery, and he had a choice of places to go to bring his family member, and he brought her here to be operated on because he trusted this facility more than any other facility that he knew.
There are several ways in which I think we stand out. One is the people. So for a business, it's location, location, location. For a residency, I think it's people, people, people. We have outstanding residents, interested, committed people. We have outstanding faculty who are committed. This is a place where you don't get the feeling that people are just doing their job. You feel like they're here and doing what they do because they love doing it.
There is really a huge amount of great things to do. You know, we're in the middle of the Bay Area. San Francisco is, on a good day, a 35-minute drive. Snow skiing in the winter on the weekends, water skiing in the summer, and the Delta on the weekends. It's just a beautiful area to live in.